Hi, I'm Andy Squire's avatar, and I'm talking as a regulatory safety architect and founder of PatientCentricCare.AI. Healthcare is very good at recording doctor-patient visits, but between those encounters, much of the patient's story simply disappears. Back home, a hospital letter arrives. There are instructions, questions, and decisions to make, and the patient and family are often left trying to piece everything together themselves. Then, at the next appointment with a different doctor, we effectively start again. That's the problem we're solving. Not another medical record, but the missing continuity between healthcare encounters in the patient's own words. Healthcare remembers the appointment. We want healthcare to remember the person. Now imagine the same person arriving at her next appointment with continuity already in place. Before the visit, Home Companion helps her think through what has happened and what she wants to discuss. MyHealthCanvas helps capture what matters in her own words. Those interactions build her health memory, a persistent, patient-controlled story that can carry forward from one encounter to the next. The caregiver remains in control. The AI doesn't diagnose, prescribe, or take any clinical authority. It helps the patient arrive better prepared with the context that would otherwise have been lost. Same person, same memory, better continuity. And our hypothesis is that continuity compounds. A persistent health memory helps the patient ask better questions, giving them every chance of better care and better outcomes. And this is where the proposition becomes much bigger than a patient app. Imagine hundreds and eventually thousands of people building their own longitudinal health memory across a hospital or health system with consent, human authority, and traceability governed through PCC-SafetyOS. The organization gains a new continuity layer around its existing systems. More patients create richer longitudinal memory. Deployments generate governed real-world evidence. Evidence builds institutional trust, and trust enables further deployment. That is the human-centric flywheel we are building. Patient value at the individual level, compounding into an enterprise platform. To sum up, the patient owns the memory. The patient and the healthcare system benefit from the continuity.